Action.
Hi, my name's Elizabeth Patton. I'm a student of OPSU, Oklahoma Panhandle State University, and today we will be performing a head-to-toe assessment of my patient. My patient today is a 26-year-old female, and she complains of a headache, nausea, and blurry vision. Hello, how are you?
Hi, I'm good. I'm here to get a health assessment. Can you help me?
Okay, would you like to sign in?
Sure.
Okay, go ahead and sign in, and we'll be right with you.
Thank you.
You may have a seat. Abby. Clean hands. Hi, are you Miss Garza?
Yes, ma'am.
Hi, Miss Garza. My name is Elizabeth Patton, and I will be your nurse performing the assessment.
Thank you.
Okay. Can I have your full name and date of birth?
Nancy Garza, 11/06/89.
Excellent. And do you know what day it is today?
Yes, today is Monday, November the 9th, 2015.
Excellent. And do you know what day it is?
Monday.
Monday. Okay. And do you know what time it is today?
Like 7 p.m.?
Okay, great. And so you are alert oriented times 3, and that's pretty normal. Just want to ask you a few questions about your history before we get started with our assessment. Okay, just want to get to know you a little bit. Can you please tell me your history, your health history?
I was diagnosed with pre-hypertension. I have high blood pressure.
Okay.
I also was diagnosed with anxiety.
Okay.
I have been diagnosed with polycystic ovarian syndrome,
Okay.
and I have allergies as well.
Like seasonal allergies?
Yes.
Okay.
Yeah, it's not year round.
Okay. All right.
And that's it.
Do you have any allergies to any medications or any foods?
No, I don't have any allergies.
No allergies to latex?
No.
Okay, great. And can you tell me a little bit of any surgeries in the past?
Yes. I had the gastric bypass on September the 9th, 2015.
Okay.
And that's it. That's all I've had.
Okay, great. And are you taking any medications today?
Yes, I'm taking Urosadol.
Urosadil?
Yes, the
Okay.
one to avoid the gallstones.
Okay.
And I'm also taking Pepsid daily.
Pepsid?
I'm taking Claritin, loratadine for
Loratadine.
my allergies.
Would that be 10 milligrams?
Yes.
Okay.
I'm also taking my vitamins, my multivitamins, my B complex, my calcium citrate.
And how many of those multivitamins do you take a day?
I take 2 a day.
Okay. And the B complex?
500 micrograms.
Okay.
Yeah.
All right. And besides these medications, do you take anything for pain?
No, sometimes I take Tylenol for pain.
As needed?
As needed, yes. They prescribed me Xanax for my anxiety, but I don't take it.
Xanax, okay.
And I was on high blood pressure medication, but I'm off of it now.
Since your surgery?
Yes, due to the weight loss.
Okay, excellent. And I know you're 26 years old. When did you first started getting your menses or your periods?
I started my period when I was 11 years old.
Okay. And are you currently taking birth control?
No, I've actually been off of birth control for 3 months now.
Okay.
I stopped taking it a month before my surgery because my surgeon told me to stay off of it because to avoid potential blood clots in the legs.
Okay, and so you're not taking your birth control. You stopped that because of the blood clots or the risk for blood clots. And when was your last period?
It was October 30th, I believe. So just a week ago.
A week ago? Excellent. And everything's normal? You have a normal? And how many days do you last on your period?
About 3 to 4 days.
Which is on average for a female.
Okay.
Would you say it's a heavy or more moderate?
No, it's moderate.
So I was reading your complaint and you're coming in here for a headache, blurry vision, and did you say you feel a little bit nauseous at times?
Yeah, I do feel a little bit nauseated sometimes. Sometimes I see blurry and then I get these really bad headaches, just pounding.
Pounding? And how long would you say that you started feeling this way?
It's been going on for maybe about a week and a half.
A week and a half?
It's gotten worse every day.
Okay, and so it's a week and a half of headache, blurry vision, and nausea.
Yes.
Okay. Does it stimulate it more when you're around a crowd of people, very loud, or overstimulation?
Yes. Yes. Especially in rooms that are very lit, or have really bright lights.
Okay.
Or if the sounds are too strong, too loud.
Excellent. And a little bit of your family history, like your dad or your mom, do they have any diabetes, any high blood pressure?
Diabetes on my mom's side.
Okay.
No high blood, actually yes, high blood pressure on my grandparents.
Grandparents?
Yes. And cholesterol as well.
Is that your mom or your dad?
My mom.
Okay, and what about your dad?
No, my dad's healthy.
Healthy?
Yeah.
Good.
Nothing on his side.
Okay, excellent. So what I'm going to do is I'm going to start my health assessment, and I will be taking your vitals right now, and then we'll go from there. Okay, excellent. Okay, Ms. Garza, I'm going to be taking your vitals.
Okay.
This is a blood pressure cuff, and it goes here. This here is the pulse ox, and it's going to be monitoring your heart rate.
Okay.
Now this is going to squeeze a little hard, okay? Underneath your tongue. Your temperature is 98.6, and that's within normal levels. Your blood pressure is 131/90.
It's a little high, right?
It is a little bit higher for your age, so. And your heart rate is 84, which is quite normal. Okay, Miss Garza, right now what I'm gonna do is I'm just gonna assess your head. I'm also gonna be looking at your skin and assessing your circulatory, your skin. Okay, so I'll be doing that right now. Okay. So I'm gonna be looking at your skin. Do you have any rashes?
No.
No rashes, no blisters.
No.
Okay, I see that your skin turgor is good. You're well hydrated. Okay. You have good capillary refill. All right. I do see that you're well hydrated and very moisturized. Your skin looks very even and nicely toned. I don't see any masses. I don't see any discolorations or anything that could stand out as an abnormality. Okay? I don't see any moles with any deformities.
Okay.
So your face appears symmetrical and rounded. Okay? With no deviations. Okay, and it's consistent. It's uniform in consistency, and no nodules are present. Okay, I'm gonna be checking your scalp.
Okay.
Your scalp is nice and moist. I don't see any masses. I don't feel anything. Your hair is nice and shiny. Okay, with some areas of a little bit of thinning. Okay, so the hair is nice and shiny. Okay, it is a little bit silky, so that's good. And there's no signs of infestation of any sort. Okay, right. So right now I'm gonna be just checking your sinuses.
Okay.
Okay, I'm gonna apply some pressure here. Right? Does this hurt?
No.
No. Here?
No.
No. Here?
No.
Okay. So I'm gonna have you look this way and over to this side. Good. And back and forward. So your range of motion and your upper extremities is good. Okay, so you're able to move without any pain.
Right.
Right. Your ears, the pinna of the ears seem good, and they both look very symmetrical. Okay, so the earlobes are bean-shaped, okay, and parallel and symmetrical, right? Okay, the pinna of the ear recoils when I press down on it. Okay, so that's good.
Do it again, but with this ear, so they can see.
Okay, so this ear, the pinna recoils when folded. Okay. I'm gonna press down here.
Speak up.
The pinna recoils when folded, so that's
Okay.
within normal. Okay. I'm gonna be checking your thyroid. I'm gonna have you tilt back, and I'm gonna feel for it. Would you swallow for me? Swallow again. Okay. Do you have any pain? I don't feel any masses. I don't
No.
feel any nodules in the substernal cavity. I'm gonna check your lymph nodes here. I don't feel any swelling of the lymph nodes. Do you have any tenderness when I press down?
No.
No? Okay, good. Your skin feels warm and moist. All right, good. All right, so let's see. Okay, so your thyroid seems normal. I don't see any protruding or any goiters. So there are no nodules palpable in your throat and your neck area, in the region of the neck area and the substernal.
Okay.
So I'm gonna listen to your thyroid area. Everything is within normal.
Okay.
Okay, that was just listening to the thyroid. I don't see any swelling. Ms. Garza will be conducting a hearing exam. Okay, the first exam is called the Rhines exam. Okay, I will be placing this on the position of the ear, and you will let me know if you hear it the loudest on position A or position B.
Okay.
Okay, let's get started. Position A or position B?
Position A.
Excellent. Okay, and now I'm going to be doing the Weber exam. Okay, I will be placing this over your head, and you will be letting me know if you hear it more on the right, the left, or in the middle.
Okay.
Okay.
In the middle.
Middle?
Yes.
Excellent. Okay, Ms. Garza, I'm going to be conducting an eye exam.
Okay.
Okay, I will have you cover one of your eyes, and I will have you look at my open eye, and I will demonstrate my fingers, either 1 or 2, and you will let me know when you see them. Okay? So I'm gonna have you cover your left eye. Just slightly cup it. There you go. Okay, and I'm gonna be closing my eye. Okay? And you will be looking at my open eye.
Okay.
Okay? Okay. You let me know when you see it. You see this?
Yes.
Will you call the number?
2.
2 fingers. Good. Okay. Here?
1.
Good.
2.
Good.
1.
Good. All right. So we'll cover the other eye. Okay, and we'll repeat the same process. Okay? Ready? How many fingers?
2.
Here?
1.
Here?
2.
Here?
1.
Here?
2.
Excellent. So now we're going to be doing another test. I will be wiggling my finger, and you will let me know when you start seeing it in your vision. Okay? So go ahead and cup one of your eyes. Okay? Not too much pressure on that eye. Good. Okay? So you will see it here. Let me know when you see it.
Yes.
Okay? Here?
Yes.
Good. Here?
Yes.
Okay? Here?
Yes.
And here.
Yes.
Good. So now the opposite eye. So here,
Yes.
here,
Yes.
and here.
Yes.
Good. Excellent. Now what we're going to be conducting is several exams. The first one's going to be to check the cranial one, and that's the olfactory nerve. That's how well you can smell. Since you do say you have some allergies, we're going to be checking that. Okay? So I'm going to have you close your eyes, and then you're going to be pressing one of your nostrils closed, not too much. Okay, and I'm going to be presenting to you a familiar scent, and you would describe to me what that is. Okay? Can you tell me what that is?
Alcohol.
Alcohol. Good. Press the other nostril. Can you tell me what that is?
It smells like coffee.
Coffee. Perfect. Thank you. You can open your eyes. We're going to be checking your cranial nerve 5, which is the trigeminal. Okay. So I'm going to have you close your eyes, and I'm going to run some sensations on your face, and you will let me know if you feel them and where you feel them.
Okay.
Okay? So go ahead and close your eyes. Do you feel this?
Yes.
Where?
On my forehead.
Good. Do you feel this?
Yes.
Where?
On my right cheek.
Excellent. Do you feel this?
Yes.
Where?
On my left cheek.
Excellent. You may open your eyes. So now we're going to be checking your cranial nerve 7. For this exam, we'll be checking your taste buds. Okay, I'm going to be placing something at the tip of your tongue, and you will tell me if it's sweet, bitter, or spicy. Okay?
Okay.
So I'm going to have you
Or
close
like
your eyes.
salty?
Or salty, yes.
Okay.
So go ahead and close your eyes. Will you please open your mouth and stick out your tongue, the very tip of your tongue. Do you taste that?
It tastes salty, like a pretzel.
A pretzel? Good. You may open your eyes. It is a pretzel.
Yeah.
I'm going to check the motor function of your face. So I'm going to have you smile. Look at me and smile. Good. Go ahead and frown your face. Frown. Good. So will you raise one eyebrow and the other? Good. Okay, will you close your eyelids? Excellent. And you can open them. So can you whistle? Good. Now can you blow your cheeks? Good job. Okay, so that's normal findings. So for this exam, we're going to be checking testing the cranial nerve 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens, which means I'm going to be checking your eye for your eye movement to check for any nystagmus, okay, which means that your eye will move this way. Okay, so I'm going to put a pin, and what I'm going to have you do is I'm going to have you just keep your head steady like this, and I'm going to have you look at me, look at my nose, and I'm going to move the pen. So when you see the pen, I want you to look at the pen and look at my nose. Look at the pen, look at my nose at different positions. Okay? All right. So go ahead, look at the pen and look at my nose. Look at the pen and look at my nose. Look at the pen and look at my nose. Look at the pen and look at my nose. Look at the pen and look at my nose. Okay? Look at the pen and look at my nose. Good? Okay? So that's excellent. Next assessment will be inspecting and assessing your back, okay, and your lungs. Now I'm going to check for your skin. Everything's intact. I don't see any masses or any abnormalities with your skin integrity. Okay, I'm gonna be inspecting your skin, and I'm gonna warm up my hands because it's really cold in here. Okay, and then I'm gonna need you to tell me if you feel any tenderness or soreness. Okay, when I press. Do you feel any tenderness here?
No.
Here?
No.
Here?
No.
Here?
No.
Here?
No.
No. Here?
No.
How about here?
No.
Here?
No.
Okay. Do you feel any tenderness here?
No.
Here?
No.
Here?
No.
And here?
No.
Okay, good. Okay, next I'm going to be putting my hands on the lower back of your back, and then I'm going to have you do a deep breathing for me. Okay, I'm going to apply some pressure here. Come in like this. Take a deep breath. And again. Okay, great. Good. So now we're going to be checking the certain areas in the back, and I'm going to have you say 99.
Okay.
Okay? So say 99.
99.
Here, 99.
99.
Okay.
99. 99. 99. 99.
Excellent. Okay, for this next one, I'm going to be tapping your back in certain areas of your back, okay? So, there, here, 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 okay, great. And it all sounds good. For the next part, I'm going to be auscultating your back, okay, and listening to your lung sounds, okay? I'm going to move this out of the way. And I'm going to have you take some really big breaths.
With my mouth open.
Okay? And breathe in through your mouth. Okay, good. 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 Deep breath. Good job. Good job. Good. Okay, good. And one last one. Excellent. Your lung sounds are clear. Garza, for this next examination, it would be of your abdomen. Okay, I'm going to be inspecting your skin, so I'm going to raise your gown. Okay, and I'm going to look at your skin. And there are no lesions or abnormalities on it. It looks nice and intact, and it's rounded and contour. Okay, so now I'm going to be auscultating your abdomen. Okay, so I'm going to start at an inch above the umbilicus. Okay, so is this where your belly button's at?
Yes.
Okay, so all right. Okay. Okay. So I can hear some active vowel sounds, which is good. Okay, so my next step would be palpation, and it's going to be a light palpation. Okay, so I'm going to start at here.
Okay.
Okay, so it's just going to be a light palpation. Do you have any tenderness here?
No.
Okay, here,
No.
here,
No.
no, here, no? Okay, good. So now I'm going to be doing a more deep palpation, okay? Let me know if you have any tenderness or any sensitivity in that area, okay?
Okay.
I'm also going to be feeling for your liver and for your spleen,
Okay.
okay? So, do you have any pain there?
No.
Here?
No.
Here?
No.
Here?
No.
Here? Okay, good. So I'm going to palpate for your liver, okay? And it's going to be about here. And it's going to be a deep palpation, okay? Do you have any tenderness there?
No.
Okay, so now we're going to move over to your spleen. Okay. And here, do you have any tenderness? I'm going to push up, okay? Tenderness there?
No.
Okay, good. For this next assessment, I'm going to be checking your motor skills and also your neurological skills, okay? So I'm going to put my finger up, and you will touch your nose to my finger, okay? You will follow through as I move around, okay?
Okay.
Go ahead, start. Again. 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 Try not to move your head. There you go. Again. Again. Good job. Okay. I'm going to be checking for your strength. Okay, so I'm going to hold your arm here, and I'm going to pull down as you pull forward. Okay?
Okay.
So let's go ahead and get started. Strong. Okay? Great. So I'm going to have you take a grip of my fingers while I pull away. Okay, ready? As hard as you can. Good job. Now we're going to test the other one. Okay? So flex here and try to flex forward.
Okay.
Towards you. Good job. Strong. And here. Good job. For this next assessment, we'll be checking the strength and your tones of your lower extremities, okay?
Okay.
So as I push down, I want you to push up with your leg. Okay. I'm gonna press down. Good job. Okay, next leg. Up. Good job. So I'm gonna put my hand underneath your leg, and I want you to push down. Okay. Push down, push down. Okay, good. And up again. And down. Okay. I'm going to be checking for your hips. Okay, so I'm going to be in this area. I want you to move your legs a little bit wider. And I need you to push in. Okay, good. And now bring your legs close. And I need you to push out. Good job. Okay? For this next exam, we're going to be checking point-to-point movement of your legs. Okay, so you're going to be bringing your leg here and running it all the way down, all the way to your toe. Okay? As controlled as possible. Okay, go ahead and go. All the way to your toe. Okay, good. Now next. all the way to your toe. Excellent. So I'm going to be feeling for your foot, and I need you to tap it with your with this plantar section.
Okay.
Okay. Go ahead and tap it as fast as you can. Good. Next. Okay. All right. So next we're going to be checking for any swelling or edema, and I see you have none. Okay, of your lower extremities. We're also going to be checking for your gait. So I'm going to have you stand up, and we're going to be walking across the room. Okay. So for this exam, you're going to be walking forward across the room. Excellent. Now turn around and back over. For this other exam, you're going to be walking on your tiptoes. Good job. Now on your heels. Excellent. For the next examination will be the breast for the females. There are 4 major sitting examinations used for clinical breast examination. Every client should be examined in each position. For the first position, the client is sitting with her arms on the side. For the second position, the patient has her arms abducted over the head. Position, the client is seated with their arms around their waist, into their hips, and simultaneously contracting the pectoral muscles as such. For the fourth position, the client is seated and is leaning forward while the examiner supports. While the client is performing these maneuvers, the breasts are carefully observed for symmetry, bulging, retraction, and fixation. Abnormalities may not always be apparent. Position 3 is specifically assists in eliciting dimpling of the mass. A normal finding would be overlying the breast should be even. Okay, they may not be symmetrical at rest. The areola is rounded or oval with the same color, and it depends, light pink, tan, or darker brown. Nipples are rounded, everted, same size, and equal in color. Okay. The veins may be visible but not engorged and not prominent. And there are no obvious masses noted. Okay, and there should be no retractions or dimpling. Okay. Palpation of the breast. Palpate the breast along the imaginary concentric circles following clockwise motion. So, like so. The breast examination is best done 1 week post-menses. Each areolar areas are carefully palpated to determine the presence of underlying masses. Each nipple is gently compressed to assess for presence of discharge. For the following exam, we will be conducting an eye exam, eye testing exam, the eye chart, and the 20/20 vision. During an eye exam and test, we will be using a chart. In this case, we will be using the Snellen eye chart, developed by Dutch eye Dr. Herman Snellen in the 1860s. During an eye exam, your eye doctor will ask you to find the smallest line of text letters that you can read. If you can read the bottom row of letters, your visual acuity is very good. In the US, the standard placement of the eye chart is on the wall that's 20 feet away from your eyes. Since many eye doctors' offices don't have rooms that are 20 feet long, in a smaller room, the eye chart may be behind the patient's chair. Using mirrors to make it appear in front of you and to simulate a 20-foot distance. A vision of 20/20 is usually considered normal vision, meaning you can read 20 feet a letter and most humans being able to read. In the United States, you are considered legally blind if your best corrected visual acuity, meaning your best distant vision with eyeglasses or eye contacts, is 20/200 or worse. To get a driver's license in most of the US, your best corrected visual acuity must be at 20/40. The purpose of the exam is to check for visual acuity, an overall examination of the eye. If you feel that you are experiencing a visual problem, or if your vision has changed, an eye exam may be necessary. Visual acuity tests are frequently given to children because early testing and detecting can prevent vision problems from getting worse. During your exam, you will be asked to cover one of your eyes, either with your hand or with a patch. You will be asked to read out loud the letters that you will be seeing with your uncovered eye. This process is then repeated with the other eye. Another frequently used visual acuity test is called the random E's. This involves the patient identifying the direction of the letter E. The doctor will switch out the lenses you look through until you can see the chart clearly. This will help the doctor decide your ideal eyeglasses or contacts. Okay, for this next part of the examination, we will be inspecting your ears, your nose, your eyes, and your throat. Okay, first of all, do you have any difficulty with your vision?
I did have a little bit of blurry vision,
Okay,
but other than that, no.
you don't see any floating
No.
images or floaters, or do you have any graininess in your eyes?
No.
And you mentioned that you don't wear glasses
Right.
or contacts?
No, I don't.
Okay, do you use any color contacts just for cosmetic?
No, nothing.
No? Okay, great. And do you ever get redness to your eyes and irritation?
Sometimes, yeah.
Okay, would you say it's more caused by seasonal allergies?
Yes.
Okay.
Yes.
Alright, so I'm going to be inspecting your eyes and your ears, and you let me know if you have any tenderness to any parts, okay?
Okay.
I'm going to press on your eyelids, and you let me know if that's going to cause any pain.
Okay.
Close your eyes.
No.
No?
No.
Okay, good. So your ears are both symmetrical, and I don't see any blemishes or abscesses. I do see a little small macula on the back of your ear, right there. And I do see a scar in this area. Was that part of a earring?
Yeah.
Okay, good. So I'm gonna go to the other ear.
Okay.
I'm gonna move your hair back. Alright. There are no lesions to this ear, nothing to the back. Just looks like another little scar, possibly by another
Piercing.
piercing. Okay, good. Right, so I'm gonna get my otoscope. Have you had any problems with your hearing at all?
Yes. I had problems with my hearing on my left ear due to allergies.
Okay. Did you have any drainage?
No.
No drainage?
No, it just felt like it was like clogged.
Clogged? No pulsations?
No.
Okay, just making sure this is working. Okay, I'm gonna pull on the pin of your ear. I'm gonna look in there. Your ear canal looks moist. And I do see a minimal of looks like dry cerebrum. I'm gonna advance it, okay?
Okay.
So, you know. And the structures inside look intact. I'm gonna look up. try to be. Okay, I do see your eardrum. It's gray in color and it looks intact. So it doesn't seem to be irritated. Do you have any itchiness in your ear?
No.
None? Okay. Right. So the eardrum looks healthy. The tympanic membrane looks intact. Okay, so right now we're going to move over to the other ear canal.
Okay.
Just let me know if it hurts. The inside structures look intact, moist, no redness, no swelling, no edema, just minimal collection of dried cerebrum. I'm going to advance in to focus on your eardrum. I can see your eardrum and it's gray in color. It looks intact. There are no lesions on it, no perforations, no edema noted. I can see the tympanic membrane within normal levels. Okay, I'm going to come out. No swelling. Okay. I'm going to come over and check your nose. Let me know if this hurts.
No.
No? No hurting right here?
No.
Does this hurt?
No.
Okay. I'm going to be looking, inspecting inside your nostrils. Okay, I'm going to come in here, look inside. Your nasal cavity looks intact. It's moist, it's pink, and there are no obstructions. Do you have any difficulty do you snore?
No.
You don't snore at night. You don't have any difficulty breathing?
Just when I have allergies.
No. Nasal congestion?
Yes.
Any nasal dripping?
Sometimes.
Sometimes with the allergies?
Yes.
Okay. I'm gonna go in here and look. Okay, I do notice that your turbinate, your inferior turbinate, is protruding out somewhat, just slightly on the left nostril, which indicates what you've complained, the sinuses. Okay, so I'm going to go over to the other. Okay. It's pink, it's moist, and your inferior turbinate is more pronounced on this side than it is on the other side. And it also indicates sinuses, allergies. It is a little bit larger than the other one. It doesn't obstruct it from breathing.
No.
Pinch your nose on this side. Breathe.
Go
Do the
ahead.
opposite.
Yeah,
Okay.
this one's a little harder.
A little
to breathe.
harder to breathe. Yeah, because you do have that inferior turbinate, slightly larger than the left. Okay. but I see no nasal drainage at the moment. There's no redness. It is a little bit tenderness. It's a little bit inflamed on this side, okay? And I do notice a little bit of it protruding through here. It's just a little bit of a raised area, okay? All right. Now, next, I'm going to inspect your throat, your teeth. So with your nose and your breathing, I noticed that there was no nasal flaring of your nostrils, indicating that you are able to breathe correctly, minus the somewhat obstruction you have on this side of your nose. Everything's, your nose is midline to your face, which is proper. Your nasal septum is midline. There are no deviations that I noticed in your nostrils and inside your nose. Your nasal cavity, the nasal mucosa is a deep pink, which is pretty normal, and that's what we wanted. There's no purulent discharge noted, so it's pretty moist. I didn't see anything, so that means that you don't have an infection in your nose. The anterior septum is a little bit thicker than the posterior septum, and there are no perforations in your nasal septum, and I didn't see any crusting in there. Following assessment, we will be checking and assessing your oral cavity, your dental, and your tongue. Okay. So I get my otoscope and I have a tongue blade. Okay. So I'm going to be having you open your mouth wide. Okay. Move your tongue from side to side. Hold it. Okay, and over here. And up. So I don't see any evidence of dental caries. I see about 32 mature teeth with a whitish, yellowish appearance to it. Okay, and smile. The gums are intact, and I'm going to press on here. No tenderness?
No.
No tenderness. Open up your mouth. The oral mucosa is moist. Okay, and say ah.
Ah. Ah.
Okay, the palate of the mouth.
Ah.
Okay, good. The palate of the mouth is intact. It's a pinkish red. The gingiva is like a coral pink, which is good. I don't smell any foul odor, which is good. I'm gonna have you stick out your tongue. Okay, and turn it from side to side. Stick out your tongue. And side to side. And up. Good job. No oral sores noted. Okay, and to side. And to the side. Okay, I'm going to inspect the back of your throat with this tongue blade. I'm going to advance it in. Okay. Say ah.
Ah.
Say ah.
Ah.
I do notice that. Okay, relax. The uvula is back there. Say ah.
Ah.
You have tonsils. Ah.
Ah.
And they're not inflamed. Okay, your tongue is moist. Ah.
Ah.
Ah again.
Ah.
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 Okay, I do see some white patches on the way back of your throat. It's on the deepest side. Do you have any soreness of your throat?
A little bit.
A
Yes.
little bit. It's not very much. It's just
No.
tiny ones.
Yeah.
Okay, again. So the uvula is midline and centered. Okay. And your teeth, I don't see any malocclusion, which would identify your molars or your teeth to be overlapping. But I don't see any of that. I don't see any oral sores. I don't see any caries. It doesn't have a bad or a foul odor. I don't see any sores on your gums. Everything looks really healthy. Your lips are pink and they're symmetrical. Your tongue is moist and it's easy to palpate. Okay. And no sores noted too. Your tonsils are behind the pillar, which means they're not inflamed. Okay. Now we're looking at the eye and inspecting the internal structure of the eye. So we have Nancy here, and she's going to be my victim today. And we're going to be looking at your cornea, at the iris and the pupil. And we're also going to be looking at your lens, the sclera, and making sure that all of those are in working order. Okay, I'm going to shine the light, and I'm going to have you look straight to the camera. Okay, and I'm going to shine the light just to inspect the cornea. Okay, your iris is present, and it's like a honey brown. Your pupils dilate when I flash the light on you, which is good. The cornea is intact. I don't see any lacerations. Okay. Will you look up? I see the cornea is avascular. There are no vascular blood vessels present. So for this exam, I'm going to be using the ophthalmoscope to examine the inside of the eye, so we can look at the retina, your pupil dilations, and we'll see what we find in there. Okay, I'm going to have you kind of look over here on this side. Okay, I'm going to look at your left eye first. Okay, keep looking straight. I can see the retina, and I do see the vessels in there, and they look intact. I did see the optic nerve, and it looks intact in there. I don't see any blemishes to your optic nerves, and your macula is intact. I do see the optic disc. It's that little cluster, whitish or yellowish looking, and it looks normal and right in the fundus. I don't see any hemorrhages in there. I don't see any blotches that would indicate any sort of hemorrhages. So for this next assessment, we'll be assessing my patient's motor reflex in the lower extremities. Okay. See that? Perfect. So we'll go over and check the other one. Excellent. So for this next assessment, we'll be assessing my patient's foot. And the first thing I do notice, I don't see any sores, but I do notice that she has a round, hard callus right center to her foot. She says she used to dance folkloric dancing, so that's where she gets that callus. You're not diabetic, but I'm gonna be doing this assessment of your foot with this monofilament brush that we have here, and I'm gonna put it in several sites, and you will let me know if you feel it. Okay. So relax your foot. Do you feel that?
Yes.
Do you feel that?
Yes.
Where?
Right here on this toe.
Okay. Do you feel that?
Yeah.
Where?
On the little toe.
You feel this?
Yes.
Okay. Do you feel this?
Barely.
That's where your callus is at.
Yeah.
Do you feel this?
Yes.
Okay. Do you feel this?
Yeah.
Do you feel this?
Yes.
Do you feel that?
Yes.
Okay, where was that?
The heel.
Alright. Again, we see her very present callus in this area. Hard. About 2.5 centimeters of hardened area in this area. Is that painful? Does it hurt when you walk?
Yes.
It does?
Yes.
Often?
Yes.
Do you wear good support shoes?
No.
Okay. And there is areas of hardening on this side as well, possibly caused by your shoes. So I'm gonna ask you to the same test. I'm gonna ask you to tell me where you feel it. You feel this?
Yes.
Where?
On my big toe.
You feel this?
Yes.
Here?
Yes.
Here?
Yes.
Here?
Barely.
It's around your callus. Here?
Yes.
Here?
Yes.
Here?
Yes.
Here?
Yes.
Okay, I do see some dryness of her heels. So, some chafing of her hardened areas here as well. Possibly from wearing sandals, maybe? Summer foot. Okay, I'm going to assess the circulation of her feet. Her feet are warm. Bring it down. Her pedal pulses are present and strong and present, like a +2, and there's no edema noted to her foot. I'm gonna check the pulse over here. And again, it's present on this side. Okay, next. Her right foot. Her pedal pulse is present and palpable, like a +2. Okay. There's no, her foot is warm, her capillary refill is present. Okay, let me check this. And it's present, and it's like a +3. I don't see any sores present here, only dryness of the skin. Go ahead and relax. Okay, for this next step, we're going to be reviewing the proper assessment of a patient with a female patient pelvic exam. Okay, so my patient's Nancy. She's a 26-year-old female. She is unmarried and does not have any children. Her last pap smear was in June of 2015, and it was with normal results. She does not smoke, and her usual cycle is 24 days. Okay, when the patient comes in for a pelvic exam, we would need a lamp, drapes, a speculum, and gloves, and we'll have the patient undressed from the waist down. We'll position the patient in lithotomy position on the examination table, draping the patient to allow for minimal exposure. Okay, once the patient is positioned and draped, and we make sure that every equipment is nearby. Inspection of the vaginal area to make sure that there are no lesions, rashes, or any other abnormalities noted to the exterior vaginal. We would inspect the labia majora, and it may appear a little bit gaping or closed, or it may appear dry and or moist. Okay, it may be usually symmetrical, or it may be either shriveled or full. The tissue should be soft and feel and homogeneous. Labial swelling, redness, and tenderness may indicate any sort of infection, swelling. So, and also you ask the patient if she has had any scratching. The labia minora, you would separate the labia majora with the fingers to inspect the labia minora. So then you separate and you inspect and palpate the labia minora. You'll identify the clitoris, the urethral orifice, and the vaginal introitus, and also the perineum. The labia minora may appear symmetric or asymmetric, and the inner surface should be moist or dark pink. You're inspecting for any inflammation, any irritation, any excoriation, or caking of discharge of the tissue, which will suggest any vaginal infection or poor hygiene. Inspection of the clitoris for the size, it should be around 2 centimeters or less, which is about the size of my pinky, and 0.5 centimeters in diameter. Enlargement may signify masculinity condition or atrophy, inflammation, or adhesions. The vaginal introits can be thin, vertical, or slit, and we'll be looking for swelling, discoloration, discharge, lesions, fistulous, or fissures. With the labia still separated, examine for the skein and Bartholin glands. You will tell the patient that you will be inserting one finger into her vagina, and she will feel you pressing forward in. Okay, with the palm facing upward, examining into the vagina and exerting an upward pressure, and the milk of the seed gland by moving the finger. Okay, we will look for any discharge, any color, consistency, and odor, and obtain a culture if deemed necessary. Okay, we'll also palpate for any lateral tissue inside the vaginal wall, and I will also inspect for the muscle tone. If the patient has born any children, then they will you will see signs of muscle weakness, and sometimes urinary incontinence, and somewhat of a sensation of falling out. So to test, ask the patient to squeeze the vaginal opening around your finger, and then that's the way you will examine for the muscle tone. You'll ask the patient to bear down with your finger still in the vaginal opening, and you will watch for an urinary incontinence, or uterine prolapse. Okay, the perineum, inspect the perineum and palpate it. It should be soft, and some episiotomy scarring may be present for some women that have born in children. The tissue will feel thick and smooth, and it will be thinner and rigid in some of these multiparous women. In either case, it should not be tender, so we would look for inflammation, fissures, lesions, and growths. The anus surface is darkly pigmented. The skin may appear coarse, and it should be free of scarring, lesions, and inflammations and fissures. We'll be looking for lumps, skin tags, or excoriation. If and when touching the perineal skin, make sure that we wash our hands and wear gloves. Okay. So during the inspection of the pelvic exam of the female, the practitioner will be inspecting the cervix for the color, the position, the size, the characteristics, any discharge, the size, and the shape of the os. The cervix should appear pink and evenly distributed. Bluish color indicates increased vascularity, which may be a sign of pregnancy. It should be symmetric, and some of the findings: a pale cervix is associated with anemia, so we need to be looking for that. The position of the cervix correlates with the position of the uterus. So identifying if the cervix or the uterus is deviated in its position. Okay. When we're inspecting the cervix or the vaginal area, we need to be looking for any abnormality as far as any discharges. If there's any foul odor or any purulent drainage, we do want to take those samples and send them off to be tested to see if there's any STDs or HPV, and so they will be analyzed. So while we're withdrawing the speculum, we would unlock it and remove it slowly and carefully so that we are able to inspect the vaginal walls. Okay, so that would be sent to pathology, and that would be the case of assessing the female genitalia. For this next review of systems, we will be discussing how to inspect the male genitalia. We want to obtain some history on the male patient, such as difficulty achieving and maintaining erections, could be associated with some certain disease processes, pain with erections, and prolonged painful erections, and how constant or intermittent with one or more sexual partners, and also association with alcohol ingestion or medications. We want to ask the patient if they're on any certain medications, such as diuretics, sedatives, antihypertensives, antidepressants, and erectile dysfunction agents, such as Cialis and Viagra. We want to also ask about persistent erections and unrelated to sexual stimuli. For example, any history of a sickle cell anemia, leukemia, multiple sclerosis, diabetes, and spinal cord injury. Trauma to genitals or groin. We want to ask about their medications. We want to assess the direction of the penis, any curvature, difficulty with ejaculation, and the color, the consistency, and the amount. So once obtained all of that, we want to inspect the penis, and you want to inspect the patient to see if they're circumcised or uncircumcised. You want to retract the foreskin of the uncircumcised patient, of course always wearing gloves, and washing your hands and wearing gloves. It should easily retract, and it could have a bit of a white cheesy segma over the glands, and that's normal. Occasionally the foreskin may be a bit tight and may not retract as easily. Some of these conditions may be more difficult to retract, and they're called phimosis. So you want to also inspect to see if there's any swelling to the penis and the glands, and you also want to make sure that you assess for male hygiene. And the next thing would be assessing the urethra meatus. Examine the external end of the urethra. The orifice should appear slit-like and be between the ventral surface and just millimeters from the tip of the glans. Okay, the opening should be glistening and pink. Bright urethra and discharge indicates some sort of inflammation or infection. So the penile shaft, we want to check for any tenderness and induration. You want to inspect the penile shaft, and you want to be able to shift it. Assess the texture, if it's flaccid, and it should be flaccid and soft and free of any nodules. The presence of discharge may indicate a sexually transmitted disease, and a patient scrotum should also be assessed. So you want to make sure you raise the shaft of the penis upward for the inspection of the scrotum. It may be more deeply pigmented. Palpation of the testicles should have, you should assess the right and the left. You should instruct the patient to examine their scrotum at home without any gloves, so they can see if there's any nodules. Check for hernias. You would be assessing, having the patient standing, asking him to bear down, and assessing that the right and the left groin. You'll have the patient relax. The testes will be palpated using the thumb and the first two fingers, and the testes should be sensitive to gentle compression but not so tender. It should be smooth and rubbery, free of any nodules. The epidermis located in the posterior surface of the testes should be smooth, and all patients should be taught how to do these inspections at home.